All right. Good evening, everyone. I am so glad that you're here. This is Christina Campbell. Oh, people are getting in now. Well, that's great. Okay, so this is Christina Campbell. I am here to speak to you tonight about a healthy nervous system. I am recording this. This will be on my YouTube channel. And so you can listen to it over and over again if it's something that you feel like you want to repeat. Repetition is the best way of learning. Where is my YouTube channel? That's a very good question. You see how I spell my name on this slide, Christina Campbell? That is my YouTube channel. So if you go out to YouTube and you type in Christina Campbell, you should find my channel, subscribe to it, and you'll be able to see all of the videos that I've put out there. Oh, some of them have been out there since 2007. So you're going to get a lot of good information. Well, I think it's good information anyway. And some of it's dated, I'm sure, but these recent ones are always going to be out there. So you'll be able to learn more. Tonight we're going to be talking about the healthy nervous system, and what we're going to be learning is, first of all, what comprises the nervous system. If you know me, you know that I love to talk a little bit about the anatomy and physiology so that you have a good foundational understanding of, the systems, the glands, the organs that we're talking about. We're going to talk about how the nervous system functions and the difference between the parasympathetic and the sympathetic nervous system. I think you'll find this fascinating. I know I do. We're going to talk about causes and symptoms of nerve disorders and neurological challenges, to include techniques for Parkinson's disease. So you definitely want to stay on and get that information. And we're going to talk specifically about effects of food additives and excitotoxins on the brain. People take this too lightly, and so I'm going to drive it home tonight. We're also going to talk about which therapeutic grade essential oils and applications and supplementation can support a healthy nervous system. So let's get started and jump right in. First of all, this is our central nervous system. It consists of the brain, which is our master switching center, right? And the spinal cord. The brain is actually encased in the neural cranium. It also has a protective layer of membranes called the meninges. There is a blood-brain barrier as well, and we're going to be talking about that and how oils can actually permeate the blood-brain barrier, helping to oxygenate centers of the brain that are important for emotional health, mental health, memory. This is extremely important as we get a little older. And before we started our class tonight, I was talking about a memory class that I'm taking. I'm taking a course in quantum memory, and it is fascinating how much we can learn how fast. I mean, in 3 minutes, I was able to memorize the 10 largest bodies of water on the planet, and I was able to memorize 10 words front and back in order, in sequence. And this is my second lesson in this quantum memory program. It is phenomenal. If you're interested in taking a course, you can go to nightingale.com. That's nightingale.com, and you can look up quantum memory. And the course was originally something like, I don't know, $269. And it's on sale right now for $35. Whoa, yeah. I said, I'm doing that. Yeah, I can do that. Yeah, that's a big difference from $265. But anyway, I'm glad that I'm recording this because maybe there'll be many, many people out there that will think about, you know, enhancing their memory. We're never too old to create new neural pathways and brain cells, memory cells, and learn new things. And I think we should be stretching our memories till the day we die. I don't care if you're 17 or 70, you're never too old to grow and expand your mind. So this protective membrane, the meninges, it floats in a crystal clear cerebral fluid. The brain itself is cylindrical and elongated, and so is the spinal cord. And the spinal cord lies in the vertebral canal. So it's very protective. And we can be thankful for that, right? So there is cerebral fluid. This is a picture of the cerebral spinal fluid flow, how it goes from the meninges down the spine and back up again. So when you have something like spinal meningitis, there's something wrong with the flow of that spinal fluid, or there could be a disease in that spinal fluid. So they'll have to do a spinal tap in many cases. Okay, so what is this nervous system? It's the smallest and yet most complex of all the body systems. It has an intricate and highly organized network of billions of neurons. It includes the brain, 12 pairs of cranial nerves and their branches, the spinal cord, 31 pairs of the spinal nerves and their branches. And those branches, by the way, go into different systems, organs, and glands of the body. So it's all interconnected, isn't it? There's ganglia, there's enteric plexuses, and there's sensory receptors. And we're going to talk a little bit more about sensory receptors as we go along. The nervous system integrates all of our body activities because it has the ability to sense changes, it interprets, and it reacts. And to give you an example of that, if you put your hand on a hot stove, your nervous system senses that it's hot. It interprets and tells your hand to get off the stove, and you react. It's that simple, but it's all part of a system that works automatically. It really does remind us of how fearfully and wonderfully we are made, doesn't it? Okay, so let's talk about some of these functions of the nervous system, that sensory function that I was just mentioning. Again, it detects internal and external stimuli, and it carries information to the brain, and our brain tells us, our body, what to do. It also carries that information to the spinal cord. There's another function of the nervous system called the integrative function. And this is where it processes sensory information by analyzing and storing for appropriate decision-making responses. So in other words, I may process some sensory information, and then I'll know not to put my hand on that stove again. I don't have to keep putting my hand on the stove and having that sensory function react, telling me to remove my hand. I have now learned through the integrative function not to put my hand on that hot stove. And that's a very simplistic analogy, but I think it's a good one because we learn very, very quickly. We learn as a child. If I touch something hot, I'm going to get burned. The nervous system also provides motor muscular contraction, and it also provides gland secretion. And we're going to talk about this a little bit more as we go along. There's also something called the peripheral nervous system. And this, of course, is the channel for the relay of sensory and motor impulses between the central nervous system and the body surface, the skeletal muscles, and the internal organs. It's comprised of spinal nerves, of cranial nerves, and certain parts of the autonomic nervous system. And the nervous pathways are made up of neurons. And remember, I said that there are billions of neurons. These are little nerve cell bodies, and they have axons and dendrites. These are little kind of like feelers that come off these neurons. And they have synapses. In other words, they communicate with each other. When you have good nerve health, they're constantly communicating with each other. So it says, yeah, points at which one neuron communicates with the next. So let's break it down into the autonomic nervous system, the parasympathetic, and the sympathetic nervous system. First, the autonomic. This is what you have really very little control over. It controls the involuntary body functions, like your heartbeat. If you had to be responsible for keeping your heartbeat going, I think we'd be hard pressed to still be here. It's like, don't I have enough to do? So it also controls your breathing, your digestion, glandular activity, and this is like thyroid gland, pituitary, adrenal glands, all of these things that may have something to do with hormones. All of this is automatic. And it also automatically contracts and dilates the blood vessels, whether it's cold or hot, or you know, based on what you ingested or put on your body, that will cause vasoconstriction or dilation as well. The autonomic nervous system is composed of two parts, the sympathetic and the parasympathetic nervous system. The sympathetic has stimulatory effects. Stress hormones will stimulate it, like adrenaline and non-adrenaline. So this is the one that we connect with fight or flight, always being anxious or getting ready to, you know, always having your foot on that gas pedal, so to speak. Whereas the parasympathetic system has relaxing effects. This system secretes something called acetylcholine, and what that can do is it can actually slow the heart and it can speed digestion. So let's look at both of those. The parasympathetic nervous system has been known to be called the rest and digest system. They support body functions that conserve and restore body energy during rest and recovery. There are 5 sympathetic responses, and you can use an acronym to help you remember these things if you're interested. The acronym is SLUDD, or SLUD, and it stands for salivation. When the parasympathetic nervous system is kicked in, you'll salivate more. You will produce the secretion of tears. This is called lacrimation. You might have urination. It will cause digestion, and it can cause defecation. The 3 decreased responses are: it causes decreased heart rate, reduction in the diameter of airways, because you're not breathing as rapidly. You don't need to have a vasodilator. And it will also cause constriction of the pupils. Whereas the sympathetic nervous system is that fight or flight. It favors body functions that support physical activities and reduces functions that store energy. It includes physical exertion as well as emotional responses such as stress, If you are in constant stress, you're going to be in constant fight or flight, and you're going to cause eventual adrenal fatigue. Now, the sympathetic E situations are exercise, and exercise is actually good. Emergency, if you are in a state of constant emergency, constant worry, constant stress, again, that's when you have your foot on the gas pedal all the time, and you're revving that engine all the time, and that can cause debilitation. It can cause disease. It can cause adrenal fatigue. Excitement is a product of the sympathetic nervous system, fight or flight, and I'm excited a lot of my day. I'm constantly sharing inspiring things and being excited about them, but it isn't in an emergency situation. And so I'm still burning energy, and I still keep a balance. Also, embarrassment can cause the fight or flight and anxiety and this kind of thing. So just being aware that we have two different systems that are part of the autonomic nervous system. We don't have a lot of control over how our body reacts to these things. It's just, it's enlightening, it's educational. Okay, now we're going to talk about some nerve disorders and neurological diseases. Nerve disorders involve the peripheral or the surface nerves, such as neuralgia, neuritis, neuropathy, Bell's palsy, and even carpal tunnel syndrome. Some neurological diseases are associated with disturbances in the brain, such as ALS or Lou Gehrig's disease. And we're going to get into these a little bit more in depth. Multiple sclerosis and Parkinson's disease. You might also include Raynaud's, but that also affects connective tissue. Always use cold packs for neurological problems. Never, ever use heat. If you've had a bout with shingles, that is a nerve virus. It attacks the nerves. It's called herpes zoster. You want to reduce inflammation of that virus by using cold packs. If you have or know of someone who suffers from multiple sclerosis, you never want to do a raindrop and then use hot packs. You can end it with a cool pack. You can end it with cold packs. You don't have to use a pack at all. You can just do a raindrop because it's very, very healing for these neurological diseases. And we're going to talk about the raindrop a little bit more as we go along. MS patients, as well, I believe, as Raynaud's, they need cool or tepid water if they're bathing. Swimming in a pool is really, really, in a cool pool is very, very supportive to their health. So this is something that I recommend. Okay, so let's break these down. Neuropathy. Neuropathy is peripheral nerve damage. This is damage to the nerves. How do we damage it? First of all, the symptoms are tingling in your feet or your hands, and it can eventually spread to the limbs and the trunk. Because if you continue to do things that are causing nerve damage, the damage will continue. I mean, it's common sense. If you have neuropathy, there's a couple of things that you need to change. First of all, make sure that you are not a pre-diabetic or a diabetic, because in many, many cases, this is a direct result of those two things, diabetes, pre-diabetic. I had a gal come to me for a couple of years, and she had severe neuropathy in her feet. She said that she had gotten her blood tested and that she was not a diabetic. And I said, I think you are. I think you're a pre-diabetic. At a minimum, you're pre-diabetic. We had tested her on the Zyto, and it came up with diabetic mellitus. I don't understand, the blood tests of Western medicine sometimes. Seems like their window of numbers is not the same for everybody. We're not cookie cutters. I'm not the same as you, and you're not the same as the next person. And so we sometimes have to just kind of diagnose ourselves and say, well, if I were a diabetic, what would I do to, correct my diabetes? And then test to see if the neuropathy is less than it was. Alcohol consumption. Now, I'm not going to state that alcoholism is a cause, although it is, but you can just be a wine drinker. And depending on your chemical makeup, it can cause neuropathy. It can cause nerve damage. Now, only you are going to know if you have neuropathy in your feet or tingling in your hands. Now, you can have tingling in your hands and have an impingement, from your neck as well. So it's not necessarily that it's diabetes or alcoholism or alcohol intake. So that's when I would recommend go to a chiropractor, see if they can free up that nerve that might be impinged and you're feeling tingling. That's not necessarily neuropathy. That's just a pinched nerve. So that nerve might be inflamed. That would be something called neuritis. It's causing neuritis. Anything with itis in it is inflammation. Vitamin B12 deficiency could cause neuropathy as well. The funny thing is that 2 years after this woman had been coming to me, and I continually mentioned that it could be that she was diabetic, and I could tell as well by her diet, she was diagnosed with as a full-blown diabetic 2 years after seeing me. So I know that our body is going to give us red flags or wake-up calls. And it's going to say, something needs to change. You either need to stop drinking or cut back drinking or take a vitamin B12 or watch your diet as far as sugar intake. And just listen. Listen to your body, and based on the knowledge that you're learning tonight and knowledge that you can gain from doing research, you can keep your body in a healthy state. Painkillers can also cause neuropathy, and you know what really, it just baffles me. So they put you on painkillers, it causes neuropathy, and then they have to put you on gabapentin, which is a drug for neuropathy. And I'll tell you, when you start taking all those different medications, then you're going to have issues. So let's nip it in the bud before we even get to that and start doing healthy things for our body. And we're going to cover that in as we go along. Also, exposure and absorption of chemicals can cause nerve damage. And then adding alcohol or adding complications from diabetes is just going to exacerbate it. one of my recommendations is that you boost the production of pregnenolone and human growth hormone. And there's a couple of ways that you can get pregnenolone. One of them is in a product that Young Living has called Prenolone. It's a cream. And another product that we have that has pregnenolone, and pregnenolone, by the way, is a precursor, or it is the building blocks that helps your body make progesterone. It is a major hormone, and men have progesterone and women have progesterone. Women have much more, or should have much more progesterone than men. So that next product is Progessence Plus. And you have heard me say, everybody from the age of 12 to 112 should be using Progessence Plus every single night. Take it at night. Put it by your bedside. That way you won't forget to take it. It'll be the last thing that you see. When you put your glass of water on that bedside table at night, pick up your Progessence Plus. Make an association between my health and using my oils. That's how we train our memory. Through association, through location. It's helpful to put it in the same place every day. And through imagination, that is how we teach our memory. As we make stories, imagine creative stories to help us to remember and repeat those little stories. You know, make a little rhyme out of Progessence Plus at night. It helps me neuropathy fight. I mean, just make a little, I just made that up. I know it's silly, but whatever it takes, you know, teach your mind to remember. I really, taking this course in memory, I really believe from the bottom of my brain now that there is no excuse for a poor memory. That all it is that we don't exercise it. And we have to find things that exercise it. Reading, studying, and studying means like taking notes and reviewing and answering test questions and memorizing. All of these are good exercises for the brain. We're also going to talk about some products that will help to catapult your human growth hormone production as well. Okay, another issue that you can have with nerves is neuralgia. This is pain from damaged nerves. Neuralgia can be caused by accidents. It can be caused by disease or inflammation due to an injury. Neuralgia can be very painful. It's temporary sharp pain in the peripheral nerves. It's like a stabbing pain. You also may feel around that area some numbness. So you're going to get pain and numbness. And again, the causes are inflammation due to injury, but also autoimmune diseases such as lupus or Guillain-Barré syndrome. And so what you want to do is you want to bring your health out of those diseases. And I believe that it's possible. Do you believe that anything is possible? I do. I believe that anything is possible. And I want to impart that belief to you. Rather than say we can't, always say we can. My mother used to have a saying, it's probably a very, very old saying. Arlene might be familiar with this saying. She used to say, can't never did do nothing. And it just meant that if you say you can't, you'll never do that thing. Also, a good saying is, if you think you can or you think you can't, you're absolutely right. Either way. So I'm wanting to impart to you belief that we have the ability to heal our bodies, that God has given our bodies the ability to heal itself. I do believe that. The recommendations for neuralgia or pain from damaged nerves is to apply anti-inflammatory essential oils. And we're going to go through some anti-inflammatory essential oils that you can use for neuralgia. I would recommend that you apply them neat if you can tolerate that. Otherwise, dilute them. And put those anti-inflammatory oils on 3 to 4 times a day. Also, inflammation responds very well to cold compresses. So you want to do cold compresses 2 to 3 times a day as well. Carpal tunnel syndrome is a specific type of neuralgia because it is constricting nerves that are going from your forearm into your hand. And so you're going to get pain and you're going to get inflammation. And so this is why you need to do compresses to heal that nerve. I used to have something called tennis elbow. And tennis elbow is a neuralgia and I believe tendon related. So it's nerve and tendon related pain. And it was right in, there's a divot in your elbow. And I used to do a lot of lifting, like weights. And I just, I don't know, I just aggravated it to the point of it stayed inflamed for months and months. I think it was years. And I put deep relief on it. And then I started putting ice packs on it. And I started resting it. And finally, that elbow is completely healed. It took a while. It took persistence. It took doing the same things over and over and over again. The anti-inflammatory oils of deep relief and the cold packs and resting it. Those are the 3 things I did, and healing came. So I just want to impart to you that healing can come. We need to be patient. We need to have the patience of a saint because it takes time for the body to heal. Just as it takes time for magnolias to bloom or daffodils to come up in the spring. It takes time. Be patient. Okay, neuritis. Remember I was mentioning neuritis because it's inflammation again. It's painful inflammation of the peripheral nerves. And of course, the symptoms are going to be pain and burning. You might have numbness or tingling, and you might even have muscle weakness and paralysis. And that's really what that little bit of tennis elbow felt like. There was pain, there was burning, there was, it was just very uncomfortable, especially if I was going to lift. So I had to quit lifting. I could probably start lifting again, and I probably should. But wait until it heals before you start using it again. What are the causes of neuritis? You can get neuritis from frostbite. But in the case of Bell's palsy, which is neuritis, that would not have been caused by frostbite more than likely. It was probably caused by either being pre-diabetic or diabetic or a vitamin deficiency. But there are other causes like heavy metal poisoning, and you can get tested for your heavy metal levels, or you can just go ahead and do a heavy metal cleanse. And there's a couple of ways you can do that. You can get an ionic foot bath. That's one way to get heavy metals out of your system. But I think the most effective way is through using Juva Cleanse, taking 2 to 3 capsules a day until that bottle is gone. I noticed that Stephanie mentioned that she had got Bell's palsy after delivering her twins. So I don't know if you had gestational diabetes. Some people have been diagnosed with that, or if just, having twins could have put you in a temporary vitamin deficiency. That's probably, one or the other. Stephanie says, I had no diabetes. Okay. That's good. That's good. Because as I mentioned in my diabetes and pancreas class, women who have been diagnosed with gestational diabetes during pregnancy have a greater chance of coming down with diabetes over the age of 40. So that's a good thing, Stephanie. I'm glad that you did not have gestational diabetes. So it was probably a temporary vitamin deficiency. You had babies taking everything from you. Twins, that's a lot. That's huge. My recommendation is to identify the underlying cause. Try to find out what it is. Taking master formula is going to help with your vitamin balancing, because that is a balanced vitamin supplement. And if you take that for 30, 60, 90 days, it takes 90 days for the body to really start adjusting for that, and you still have neuritis, well, that wasn't the underlying cause, but at least you've been giving your body the vitamins that it needed. Then I would probably go to this step 3, which is do a heavy metal cleanse with Juba Cleanse. Make sure that you aren't pre-diabetic or diabetic. And you would know if you had an infectious disease. I mean, that's pretty obvious. Okay, let's talk a little bit about multiple sclerosis. One of the things that I say whenever I talk about multiple sclerosis, I've had a few friends in different stages. I've actually had a friend die with MS, and she was a lot younger than I am. One of the things that is a common thread is that they don't drink water. They don't drink water. And we know we need to drink water. We need to drink at least half our body weight in ounces a day. If you weigh 150 pounds, that's 75 ounces a day. And there are a myriad of ways that you can measure your water, that you can get into the habit of drinking enough water, counting your glasses. I mean, everything from having a chart where you tick it off, 8 glasses, 3 glasses, whatever, to putting an alarm on your phone. I mean, there's 150 ways to remind you to drink water. The second thing that I have found as a common thread in patients with, in people with multiple sclerosis, is that in the majority of cases, they drink diet soda. They drink diet soda. And we're going to talk about excitotoxins, aspartame, MSG, these types of things, and how they affect the brain. So those are the 2 commonalities that I see. It is an autoimmune disease, which means that we need to build the immune system. It's a progressive disease of the central nervous system, so we really need to support the central nervous system, and I'm going to give you a lot of great recommendations. Mineral essence is one of the recommendations for MS. In many cases, they have a mineral deficiency. They need to drink more water, and they need to get off the diet soda. What MS does is it literally destroys the myelin sheaths surrounding the nerve fibers. And the nerve fibers, these neurons are in the brain, the spinal cord, the optic nerves. And so what happens is their parts of their body start to shut down, their eyesight, their ability their mobile ability, because they get muscle weakness. And MS can cause blindness. Some of the symptoms are deteriorating coordination and balance, numbness or prickly sensations. Now, just because you have numbness or tingling, don't go there right away and say, well, I must be having symptoms of MS. No, you could have an impingement, or you could have neuropathy. So, be in tune to your body. Check these things out. They'll have a poor attention or poor memory. They're not feeding their brain omega-3. Something else that I don't think I mentioned in the product list in this class, but that's very important, is something called Mind Watch. And I keep this right by my desk because every day that I'm sitting at my desk, and I've already had mine today, I take a little packet out and I take my Mind Watch. Let me see if you can see this. It's just a 1 ounce packet, I think. Oh, it's a ½ ounce packet. And it has some of the most effective essential fatty acids from any food on the planet. It comes from the sacha incha seed. And it's very, very high in essential fatty acids, and that's what our brain needs. And that's what your brain would need if you were diagnosed with a disease like this, or if you're not diagnosed with any disease and you want to stay healthy. I mean, I think it's incredible that I was able to memorize in less than 3 minutes every major body of water on our planet today. The first 10, not everyone, but the 10 largest bodies of water. I was able to do that in 3 minutes. I'm not getting older, guys. I'm getting better because I'm exercising my mind. It's so exciting for me. I just get so excited. Some other symptoms are speech impediment, incontinence, dizziness, and hearing loss. And as I mentioned before, cold baths or tepid baths, relaxed swimming are 2 of the best activities for relieving symptoms. For severe symptoms, lower the body temperature and receive a raindrop with essential oils. Lower the body temperature. I've known people to pack ice on people who are having severe MS symptoms because that calms that, that the nerve fibers down. Lou Gehrig's disease, and this is such a sad disease. I've seen, I used to teach oil classes in nursing homes, and many times there would be a man in there that was my age, and he would have Lou Gehrig's disease. This is a degenerative nerve disorder, and it too affects the nerve fibers in the spinal cord, which control voluntary movement. However, it may seem like they're affected mentally, but they're not. It does not affect their senses at all. They still can see, they can still smell and taste and hear and touch. It does not affect their bladder or their bowel function or their ability to think or reason. But it's hard to differentiate because their body just isn't working right. They have difficulty breathing. They may be unable to swallow very well, and so they'll have gagging and choking. Their head will drop because they have no muscles to hold up their head any longer. And so a lot of times you'll see them strapped in a chair to hold their head up and back. Otherwise, they're just constantly slumped. Their muscles are so weak that they cannot carry their upper body upright. And so they'll be strapped in a chair around their waist as well to keep them in an upright position because they just don't have the muscle. They might even be have paralysis, be paralyzed. They're going to have speech problems, but again, that does not mean that they can't think or reason. It's just that these motor activities have been impaired. Their voice might change, it might get more hoarse, there could be drooling, muscle spasms, muscle contractions, and weight loss. It's a sad disease. Parkinson's disease is another one where it's causing deterioration of specific centers in the brain. And, you know, I should have probably looked up what percentage of people in America or worldwide are suffering with these diseases, because I think that they're becoming more and more prevalent. And I believe and know for a fact that it's directly related to our diet, the air we breathe and the water we drink. I really believe that. Parkinson's actually affects more men than women, and the same thing for Lou Gehrig's. It affects more men than women. There's really no pain with Parkinson's or other sensation other than decreased ability to move. Symptoms appear very slowly and in no particular order. But some of the symptoms may be the beginning of tremors in your hands, involuntary shaking of the hands, or even just a little bit of the head, or both. There may be some rigidity. You're slow to move. You're just feeling stiff all the time. Or loss of balance. There may be stooped posture, trouble swallowing. Depression usually is one of the symptoms. And it might be difficult to perform small tasks, like writing out a check because of the tremors, or serving a cup of coffee. These are the small tasks that we're talking about, or even just passing something on a tiny tray, you know, if you have tremors. Restoring dopamine levels in the brain can reduce symptoms. Sulfurzyme provides a source of organic sulfur, which is a nutrient. It's a vital nutrient for nerve and myelin sheath formation. It is vital. So that would cover Lou Gehrig's disease, Parkinson's disease, and multiple sclerosis. I will tell you that it covers a lot more. It covers joint health. It covers your hair graying. It covers muscles. Sulfurzyme is much needed in our diet today. And I would go as far as to say everyone on this Zoom, anyone listening to this Zoom should be on sulfurzyme. It is a miracle for pain. And I was noticing that that Leslie was drinking Ningxia Red out of her Ningxia Red bottle. Do you have sulfurzyme in there, Leslie? Oh, for some reason you're muted, and I don't know why, because you just unmuted yourself.
I can you hear me?
Yep, I can.
Okay, it's Dr. Minky's Red Drink. So I have 2 ounces of Ningxia Red, 4 capsules of the sulfurzyme, and 3 drops of ocotea in there, and then the rest is filtered water.
Yes, I thought that's what you were drinking. Yes, that's called the red drink, and that is excellent to drink throughout the day. You can use the capsules as Leslie's doing, or you can use the powder. I prefer the powder because I take a lot. I take like a heaping tablespoon, and it doesn't bother me at all. I've been taking sulfurzyme for so many years. You just get used to the taste after a while. So this is a great segue into the effects of food additives and excitotoxins on the brain. Excitotoxins are substances such as aspartame. And we're going to show you what some of those products are in. Aspartame reacts with specialized receptors in the brain in such a way that it leads to the destruction of certain types of brain cells. MSG, which is the sodium salt of glutamate. Glutamate is one of the most commonly known excitotoxins, and both aspartame and MSG have been directly related to death of brain cells or destruction of brain cells, destruction of neuro pathways, seizures, and learning disabilities. Monosodium glutamate and aspartame. There's a strong connection between dietary excitotoxin excess and neurological dysfunction and disease. Now, remember earlier when I was talking to you about multiple sclerosis, and I said two things that I found as a common thread are they don't drink water and they drink diet soda. Diet soda is aspartame. And they had no idea that that is what caused the destruction of the myelin sheath of the nerve. And they have no idea that continuing to drink diet soda is only going to cause it to get worse. And my girlfriend died of MS, and she never stopped drinking diet soda. She said, you can take anything else away from me, but I'm not stopping my diet soda. And she did not believe us. Because I brought a nurse with me. We were really, really trying to get her on Young Living and trying to get her on water. I mean, we were just trying to help her from the core of who we are. All we wanted to do was get her to be better. And she just flat out said, you can take anything away from me, but you're not taking my diet soda. And it was end of story, because that was the very thing that was causing the destruction of the brain cells. And I'm going to tell you that a doctor won't tell you that. How is it that this information is out there? Anybody could do the research and find this information, and yet a medical doctor will not tell you, you have symptoms of MS, you need to get off the diet soda. I don't get that. This information is out there. You can find it just as well as I can. All I'm doing is I'm facilitating the gathering of information that you have access to, and I'm presenting it to you because I care enough about you to do that for you. I just don't get why they don't tell you that these things are damaging. Chronic elevations of blood glutamate, and this is in connection with MSG, can breach the intact blood-brain barrier, and numerous conditions can leave the barrier incompetent. In other words, MSG can cause brain damage. And MSG is in everything that's processed. I don't care if you're eating red Ritz crackers. It has MSG in it. It should be against the law. It should be against the law. And we give these things to our children. And we wonder why they have ADD and ADHD and neurological disorders. I mean, okay, so I'm getting a little over the top, but I'm passionate about this. Over 100 million Americans now consume products containing one or more excitotoxins, which go by over 40 different names. Chewing gum. Every chewing gum that I know of on the market today you can pick up in a gas station or Walmart or any store has aspartame in it. Check the label. I haven't chewed gum in years other than the frankincense gum that Young Living has. Chewing gum, aspartame, brain damage. Oh, sure, it's in small amounts. But do you know that that's cumulative? That every small amount, I mean, why don't we all just go start smoking again? Yeah, I mean, really, we're causing damage. Excitotoxin injury is a special concern from the fetal stage. So when you're pregnant and if you're chewing gum and you're drinking diet sodas and you're smoking cigarettes and you're doing all these things, you're causing fetal brain damage. And then we bring our kids up on sodas. This is a critical time for brain formation. This is not the time to say, oh yeah, you can have a pack of gum. Oh yeah, let's go get some Ritz crackers. Aging and free radical activity magnify the increased susceptibility to excitotoxin damage. So the older we get, the more susceptible we are to damage, brain damage from these excitotoxins that we need to stay away from. The nervous system is significantly weakened and made more susceptible to further excitotoxic injury. Here are some aspartame and MSG products, and I'm going to tell you, this is not even the tip of the iceberg. If you do the pink packets, if you do the blue packets, if you use Splenda, and God forbid that you use Accent, because that is pure, unadulterated MSG, and you're just sprinkling it on your food to enhance the flavor. They put it in baby food. They put it in formula, baby formula. In any of those prepackaged McCormick seasoning packets, you're going to have MSG at a minimum. And many of the products have both MSG and aspartame. Yeah, Sweet and Low, that's the pink packets. KFC, Kentucky Fried Chicken, he puts MSG in his batter. I mean, I have a lot of friends who they won't eat in a restaurant before asking if they use MSG. And maybe that's a question that you have to ask yourself. Yeah, I remember Accent being in my mom's pantry too, Leslie. Yeah, because, you know, they used to sprinkle it on the steaks to tenderize them. Oh yeah, I'm glad that you guys talked about, there's a difference between sulfa drugs and the mineral sulfur. There is no mineral allergy to sulfur. In fact, we have a deficiency in sulfur. So they're even spelled differently. Sulfurzyme, not sulfa. Sulfazyme. Sulfa drugs are like, I think they're like penicillin. Okay, so for a list of foods containing excitotoxins, go to www.msgtruth, msgtruth.org. And then if you want that list, you can go to avoid.htm. It's a whole list of foods to avoid that have MSG in them. Educate yourself. Stay away from this crap. I'm just saying it like it is. Okay, so what should you not stay away from? You should not stay away from therapeutic grade essential oils and their applications. And so we're going to talk about those. The first thing I want to talk about is a treatment that was developed for Parkinson's disease. This treatment is called the neuroauricular technique. I've done this many times. and it was originated by D. Gary Young. It's really good for any neurological disorders, but specifically Parkinson's. And there are 6 oils that you use along with an auricular probe, and the technique. Now, glass auricular probes used to be a dime a dozen. When I first started in Young Living, they were, you could get them on, just about anywhere. They've since become a medical device for some odd reason, and they're very, very difficult to find. You can look, if you find the source for them, let me know. So the alternative is, if you have a dropper bottle, say you finished your mineral essence and you want to wash that dropper out really well, the mineral essence dropper bottle has a rounded tip. And you can use that rounded tip as an auricular probe. You can also use the deep relief roll-on bottle, those 10 mils bottles. We have a deep relief roll-on bottle. We have Breathe Again, a Rutavala. Rutavala and deep relief can also be used in this technique, and you just roll it on with the roller ball. So what you're doing is you're affecting the largest nerve bundle that affects psychological reactions for fight or flight or stress, called the vagus nerve complex. And you're doing that by taking these oils one at a time, applying the oil to the occipital ridge of the skull. If you put your hand on the back of your head, the ridge where the skull meets the neck, you'll feel a rounded ridge. That is the occipital ridge, and you have it on both sides of your spine. In the center is that little divot. You can feel that little divot, and then it's your spine. So what you're going to do is you're going to place the oils on that occipital ridge, in that little divot, and down the spine 6 inches. 6 inches down the cervical spine. You're going to take your auricular probe and you're going to do 3 tiny circles on that occipital ridge all the way to the center. Do 3 tiny circles on the other side to the center. And then you're going to do 3 little circles on each side of the spine all the way down the spine for 6 inches. If you want more detailed information, I will be posting the NAT technique on Diamond Miners. If you are not part of my team, the Diamond Miners team, then I recommend that you go to your upline and ask for this technique, or you do a Google search and I'm sure you'll find it. The reason that we use frankincense, valerian, vetiver, Roman chamomile, cedarwood, and sandalwood is because they're all very high in sesquiterpenes, which help to oxygenate the brain. People who get NAT, who are suffering with Parkinson's, sleep much better. Tremors are diminished. It is very oxygenating to the brain. Cedarwood is 98% sesquiterpene. Frankincense is 50% sesquiterpene. Sesquiterpenes have the ability to pass the blood-brain barrier and oxygenate glands like the pineal gland, the pituitary gland, the amygdala. Also, I mentioned to you earlier that the production of human growth hormone increases nerve health, and frankincense supports that growth production. It also alleviates depression, it promotes relaxation, keeps you out of that fight or flight, and reduces inflammation. The recommended application for any of these oils is to use 2 to 4 drops on location, use them on your VitaFlex points, inhale them, diffuse them, use it as a dietary supplement, get it in your body. Don't be particular about how many drops. If you're worried about it, take a whole capsule every day. I mean, I take a minimum of 5 drops to 20 drops of frankincense in my Ningxia Red every day. Get it in your body. The next oil is Roman chamomile. You'll notice that that was part of the NAT protocol. Roman chamomile is a nerve generator, excuse me. The roller tranquil has a lot of Roman chamomile in it and could be used for a neuroauricular application, as would rutavala because it has valerian in it, and deep relief because it has copaiba, it has Idaho balsam fir. All of these are really, really good for the brain. Roman chamomile is also an anesthetic and it combats nervousness. I love Roman chamomile in a spritzer bottle. If I'm getting a little anxious about something, I just spritz myself with water and Roman chamomile. I love it. Absolutely love it. Peppermint oil is an anti-inflammatory. So if you are suffering from neuritis, it can act as an analgesic. I also mentioned deep relief. Deep relief has peppermint in it. That's what I was using on my tendonitis. That's for tendons, but I do believe that it causes nerve inflammation as well. I mean, I was in terrible pain. I couldn't even straighten my arm. My elbow hurt so bad. I had to wear it in a sling when I'd walk 5 miles because I couldn't have it dangling at my side. And I just kept working on it, and I kept working on it, and I kept working on it, and I have no pain now in that arm. When you're using peppermint oil, remember to avoid contact with your eyes, with mucous membranes, and fresh wounds or burns. Peppermint stimulates the brain, as does clarity, and we're going to talk about clarity here in just a minute. Heliochrysum literally regenerates nerves. I want to talk to you about something that we learned, a technique that we learned from Gary many, many years ago. He was noted for helping people with severe hearing loss regain their hearing. If the hearing loss is caused by nerve damage, Heliochrysum has the ability, through its aromatic properties, to build a bridge or communicate a synapse. Remember, we talked about neurons and synapses in the beginning of this class. To build a bridge or a synapse to get those nerves to reconnect, thus restoring loss of hearing in the case of nerve damage. How do you get the Heliochrysum to those nerves in the ear? Number one, you never pour oil in your ear. You take your index finger and you put a drop of Heliochrysum on your index finger. And it's really better if someone else does this to you. If you're the one suffering from hearing loss, they're going to place that finger in your ears and they're going to hold the occipital ridge with their hands. I can't do it on myself because my arms don't go backwards. But if you were, okay, I can kind of do it if I pretend that I have a head in front of me. So I'm putting my fingers in their ears and I'm putting my fingers on their occipital ridge. And I'm just holding them there. And I may only hold them there for 60 or 90 seconds. Another thing that they can do is that they can put a little bit of heliochrysum on a cotton ball and they can put it in their ears at night. Now, usually with hearing loss, tinnitus is prominent. And heliochrysum is extremely effective for getting rid of tinnitus. Tinnitus is ringing in the ears. If you have ringing in the ears, you want to use heliochrysum. Use it consistently. It's going to take a while to get that synapse to reconnect those nerves, but it will happen. It won't be one application. It'll be consistent application. Also, heliochrysum chelates chemicals and heavy metals, and that's why it's in Juvacleanse. And remember that I think it was neuralgia was caused by, could have been caused by heavy metal toxicity. Rosemary improves mental clarity, boosts the brain. If you suffer from any of these diseases or these nerve issues, the brain is the central nervous system. It's the center of the central nervous system. Get the brain functioning so that it can send signals and start sending healing. This improves mental clarity, it boosts alertness, it helps overcome mental fatigue. I've been using clarity more now because I'm really using my mental muscles in practicing my memory, and I'm reading much more, and I'm spending a lot of time thinking, really thinking and studying. And so I've been diffusing clarity because it really helps to overcome mental fatigue. It also amplifies the mental ability. And so that's why tonight I was kind of weaving in that memory stuff, because I want you to know that we can improve all of this. Wintergreen, highly anti-inflammatory, topical analgesic, works very good with neuritis because that's an inflammation of nerves. Would be very good for carpal tunnel, soothing to nerve pain, the topical analgesic. And again, you're going to put it on, you're going to just put it on where you're having neuritis or even neuropathy. If you're an epileptic or you're on an anticoagulant, which means that you're on a blood thinner, you should probably either get off your blood thinners with the direction of your doctor and use lemon and wintergreen, or, you know, keep taking your drugs and not use as much wintergreen because it works like aspirin. Wintergreen has something called methylsalicylate in it, and that's exactly the same property that's in aspirin. It's just in its natural form. So aspirin is a blood thinner. Get off your baby aspirin and use wintergreen. Lavender, anti-inflammatory, relieves nervous tension, improves mental acuity, increases beta waves in the brain. That's a good thing. That's been proven to help with children with ADD and ADHD, as is peace and calming and vetiver. So lavender, peace and calming, and vetiver increase beta waves in the brain. This was tested by Dr. Terry Friedman, who did EEGs on children and found that they had very low beta waves. And if you wonder how I remember this stuff, it's because I've been feeding my brain with these oils for 21 years. It also reduces mental stress. It alleviates depression. It makes you laugh like I am. and you just apply it like you see here. Valor. Now, Valor has been known to balance the muscular skeletal system. So how does it have a role to play in neurological disorders? First of all, it promotes feelings of self-control. And sometimes, you know, with patients that have MS or Parkinson's disease, they just feel helpless. It's very grounding and strengthening, and it helps to overcome anger and negative emotions. It opens up and releases emotional blocks. So everyone, just like everyone should be taking sulfazyme, everyone should be using Valor every day. It stimulates the limbic portion of the brain, which is the seat of your emotions. And it alleviates feelings of stress and despair. Now, this is one that I don't recommend that you take internally, but I do recommend that you wear it every day on your wrists, or you put it on the bottom of your feet, or you get a full body massage with it. Mix it in with some V6 massage oil. Oh, how heavenly would that be? I use it on my neck, wrists, and feet when I go to the chiropractor, because it helps my chiropractor to adjust me 75% easier, and it holds much longer. My adjustment will hold much longer if you use Valor when going to your chiropractor. Whenever you're using a series of oils, always use Valor Fat first. You'll find this to be true in the Happy Day protocol that I taught you guys in the emotions class, which is Valor on the wrists, joy over the heart, harmony on the solar plexus, and white angelica on the shoulders, and cleansing the entire auric field. It's also shown in the raindrop technique. We always use Valor for balancing first before we use any other oils. So again, when using a series of oils, always use Valor first. Wait 5 or 10 minutes before applying the other oils. Oh, and it does say that it contains rosewood, blue tansy, frankincense, and spruce in a carrier oil of sweet almond. Hanaway is another really great oil for nerve damage, nerve issues. It reduces inflammation, neuritis. It's an analgesic, so it deadens pain. You could use this along the nerve pathway in the case of Bell's palsy. It's strongly anti-inflammatory, and it's a powerful pain blocker. Put it directly on location. I don't recommend taking this one internally either. I would just put it directly on location. It contains the oils of heliochrysum, which helps with nerve damage, wintergreen, which is anti-inflammatory, clove, which is analgesic, and peppermint, which is a mental stimulant and an anti-inflammatory, and a digestive aid, and many other things. But aromases is another really, really great essential oil, and it's one of Kenneth's many favorite oils, in that my husband, Kenneth, is a tennis player. He loves to come home and soak in a tub with Epsom salts and aromases. He'll use Idaho black spruce, blue spruce, Idaho grand fir. He uses Northern Lights black spruce, but he always seems to go back to aromases. He loves ylang-ylang in the bath. That calms him. Those are the ones that I can think of off the top. But he uses a lot of aromases. In fact, so much so that I normally have a stash, and I ran out and had to borrow a bottle from Vonnie, and I have her replacement bottle right here waiting to see her again. The aromases has the oils of basil, marjoram, lavender, peppermint, and cypress. It's used in the raindrop technique. Here's that deep relief I've been talking about. This calms stressed nerves, reduces inflammation, it provides pain relief, and it's great for use with NAT. A Apply generously on location every 15 minutes. Contains the essential oils of peppermint, lemon, Idaho grand fir, copaiba, clove, wintergreen, heliochrysum, vetiver, and palo santo in a fractionated and virgin coconut oil. Many people love this more than Panaway. I like Panaway a lot. Kenneth, not so much. He loves Deep Relief. Find the oil that works for you. Here's my clarity. Love this plant clarity. Promotes a clear mind, amplifies mental alertness, improves brain activity and vitality. It's anti-inflammatory. It revitalizes the nervous system, and it alleviates mental fatigue, just like peppermint, because it has peppermint in it. And I didn't put the list of everything that's in Clarity, but I know it has rosemary in it. It's a fantastic oil. Rosemary and peppermint for sure. I'm trying to think of what other ones are in there. I just don't remember off the top of my head. I love to diffuse this, but you can put it in your bath water. You can remember to dilute it either in bath gel or in Epsom salts. You can put it in the palm of your hand and directly inhale it. You can put it on the edge of your ears. This is called auricular therapy or Vitaflex therapy, auricular therapy. Also, you can put it on the wrists, on the neck, on the temples, on the forehead, or on the Vitaflex points on the bottom of your feet. Brain power. If you have trouble focusing, if you have issues with concentration, if you feel like your memory is not as good as it used to be, then I highly recommend that you start using Brain Power every day. One of the ways that Gary taught us to use Brain Power was to put 1 or 2 drops of Brain Power on your thumb. Make sure your thumb is clean. Place your thumb to the roof of your mouth and hold it there for about 30 seconds. Then anything that's left, rub it on the inside of your cheeks. Make sure you don't waste any of it. And let that Brain Power go up into the cleft of the roof of your mouth and directly into the brain. Brain Power has oils like sandalwood, vetiver, cedarwood, frankincense. All of these are high in sesquiterpenes. All of these oxygenate the brain. They help clean off nerve receptor sites. This is extremely important. If you have brain fog, Brain Power will clear that fog. This long-term use will retard the mental aging process. Using Brain Power every day. And it's also beneficial for neuralgia. Okay, let's talk quickly about some Young Living supplements that help promote nervous system health. We've already mentioned sulfurzyme. This supports every major function in the body. It combats autoimmune diseases. It alleviates pain associated with inflammation, especially rheumatoid and osteoarthritis. I would say, when I was taking capsules, I was taking 4 in the morning and 4 at night. 2 capsules 2 times a day are for maintenance. That's strictly for maintenance. If you are already healthy and don't have any issues, take 2 capsules in the morning and 2 capsules at night. They're food. It's food for you. If you're looking for maintenance and you want to take the powder, take a 1/2 teaspoon. I take a heaping teaspoon. In fact, I would bet that it's a good, healthy tablespoon. Don't start out with that much. Start out with half a teaspoon and work yourself way up. I also want to recommend the best-selling book, The Miracle of MSM, The Natural Solution for Pain, authored by UCLA neuropsychiatrist, Dr. Ronald Lawrence and Stanley Jacob. And I'll show you the picture of that book at the end. Omega Gives. We were talking about essential fatty acids and omega-3s. Omega Gives has omega-3s, but it also has D3 and CoQ10. And this is a must for healthy nervous system. Any of those diseases that I talked about, especially Raynaud's, I didn't get into a whole lot of Raynaud's, but any of these diseases that we talked about, they are omega-3 deficiency diseases as well. I would recommend you take what I take to start. I take 3 Omega Gives 3 times a day. That's 9 Omega Gives a day. If you've got this stuff sitting around in your cabinets and you're not taking them, why did you spend the money? Take these things the way we're teaching you to take them and get healthy again. This is a powerful natural antioxidant, especially good for cases of neuralgia. Super B is important. Everybody should be taking Super B. I take 1 a day. I take 1 Super B a day. And this is really important to support the action of human growth hormones. It's critical for nerve function. If you do any research on B vitamins, they have a direct correlation to nerve function. So this is important during times of stress as well. Stress uses up the B vitamin storehouse. My girlfriend Pam takes two Super Bs every single day. She can tell a difference if she doesn't. Everybody needs vitamin C. Vitamin C is something you should be taking every day. Prevents premature aging, it's a potent antioxidant, and it's crucial for proper action of growth hormones. There we go again with growth hormones. All of this is supporting the neurological system. I take 2 chewables or 2 of the tablets a day. That's all I take is 2 a day. Mineral essence. Mineral essence is something I have started taking every night again. I just know that as I'm aging, I need all the help I can get. And I need my minerals so that I can stay healthy. And it has 60 ionic minerals in it. And all I do, I'm in a habit now. The last thing I do before I go to bed is I get my glass of water that I set near my bedside table. And as I'm getting my water out of the refrigerator, you know, I have one of those refrigerator water dispensers. I get a little shot glass out. I fill it with 5 dropperfuls of mineral essence. I put a little bit of orange juice in there. I swirl it around and I knock it back. And then I take a swig of water and then refill my glass of water again. And I've been doing that pretty faithfully every night. Get into a routine. This is how you start using this stuff regularly. It's vital for assimilation and absorption. It's necessary for proper immune and metabolic function. It helps prevent disease and aging, and it balances your electrolytes. PD8020 contains pregnenolone and DHEA. Now, at present, I am not taking PD8020 regularly, but I have taken it regularly. If you have neuropathy, you should be on PD8020 regularly. I would take at least 2 capsules per day if you have neuropathy, and possibly bump it up to 4. Just be aware of how your body is changing and, you know, what's happening with your central nervous system, because it does support the central nervous system. Of course, drinking makes you red. Eat wolfberries can reverse many signs of aging. boosts the brain power. It's low glycemic and it protects against free radical damage. I recommend 2 to 4 ounces a day of the Ningxia Red juice. I put my sulfurzyme in there. I put lime in there. When I put lime in there when I'm making my red drink, because when I make it in the bottle, I put a tablespoon of sulfurzyme, 4 ounces of Ningxia Red, and about 10 drops of lime juice. Lime helps the production of glutathione, which is good for a healthy pancreas. This is the raindrop kit. We talked about the raindrop kit earlier. In any neurological disease, especially in the case of shingles, get a raindrop. Any type of, MS, Parkinson's, Lou Gehrig's, any of these neurological diseases, get a raindrop. Any autoimmune deficiency disorders, lupus, get a raindrop. It stimulates energy impulses and it dispenses the oils along the nervous system through the entire body. Essential oils applied to the spinal column are absorbed through the nerves that feed the entire body, helping to reduce spinal inflammation and bringing the body back into balance. And you get 2 8-ounce bottles, one of Ortho Ease and one of the V6 massage oil, and you get I think it's 9 essential oils, 5 milliliter bottles, aromaceas, basil, cypress, marjoram, oregano, peppermint, thyme, valor, and wintergreen. Yep, the raindrop. So here is a raindrop testimonial from a friend of mine. And I have known Nancy Weber for at least 15 years. We went to Ireland together. We see each other at convention all the time. She's out of New Jersey. And she told me this story when I first met her. She says having a central nervous system damage and spinal surgeries decades ago, I had continual pain and spasms throughout my entire body. In 1991, I was completely paralyzed for a few weeks from the damage. 2 wonderful friends and healers used the raindrop technique on me. And for the first time since I was 25, I was able to get up pain-free. That night, I had no leg or back spasm. 3 weeks later, I had the great fortune to learn this remarkable technique from Gary Young. This technique has kept my immune system strong, my body free, and far stronger than I have been in years. At age 62, I can easily say it has reversed most of the damage to my body, and my ability to help others has expanded tremendously. Nancy Weber is a professional raindrop technician and teaches raindrop training all over the world. She is edging on her 80s, and she is still just as active today as she was when I met her in her 60s. So it's incredible what these do. And if you're not giving raindrops and if you're not receiving raindrops with your friends and your family, what is holding you back? I want an answer to that question. Why aren't you doing raindrops on your spouse? Why isn't he doing them on you? Why aren't you doing them on your sister-in-law or your brother-in-law or your neighbor? Everybody could use a raindrop. Ortho Ease is what's in the raindrop kit, and it is a wonderful massage oil for muscular aches and pains, neuralgia, neuritis. It has wintergreen, peppermint, thyme, and marjoram. It's just really great for all over body relief and pain and inflammation. So if you are on this call tonight, and I know that there were 19 on this call tonight. If you are not a member and you're on this call, you can become a member by getting a raindrop technique or a raindrop kit, excuse me. And you can do that by getting a premium starter kit or a basic starter kit. A premium starter kit is going to give you a diffuser and 12 oils, and then you'll be able to get the raindrop kit at wholesale. The raindrop kit at wholesale is $138.75. If you get the basic kit for $35, you can also get the raindrop kit for $138.75. Everybody should have a raindrop kit in their arsenal. If you are not already enrolled in Essential Rewards and you have been suffering from nervous tension, neurological disorders, any of the things that I mentioned tonight, that I want to recommend to you a 90-day nervous system program. And when you are on a 90-day program, you need to be on Essential Rewards so that you get free things that will help in your journey toward better health. In the first 3 months, in that first 90 days, you're going to get 10% back on everything that you order. And if you decide that this is a lifestyle that you want to pursue, then you're going to receive 20% back in your 4th month for 2 years. Until the 25th month, you'll begin getting 25% back in free product points for the rest of your life until they quit doing Essential Rewards, or which I don't see happening. You also enjoy reduced shipping. There'll be a new shipping offering probably next week at convention, so I'm looking forward to sharing that with you. And you'll never run out of products to support a healthy nervous system. So here are some suggestions for your Essential Rewards order. Sandalwood and Roman chamomile. These are both used in the NAT, or the neuroauricular technique. Panaway and brain power. If you need to boost your brain power, you better have brain power on hand. And Panaway, of course, is great for any neuritis. Omega Gize, Mineral Essence, Ningxia Red, and Deep Relief. All of these are must-haves, whether you have neurological disorders or not. Remember, I take 9 Omega Gizes a day because we need them for our brain health. And I really honestly feel like my brain is getting better and better every day. I honestly do. I'm exercising it. I'm feeding it the nutrients that it needs. I'm not getting older, guys. I'm just getting better. Here are some resources for you. The Essential Oils Desk Reference, I highly recommend. Look for an auricular probe. The Miracle of MSM, the natural solution for pain. Look it up on Amazon. You could probably find just about any of these things on Amazon. The Better Brain book. And there are flyers or pamphlets out there about the raindrop technique. Again, there's new ones coming out all the time. Just look for them. I want to thank you for joining me tonight on A Healthy Nervous System. And I want to welcome you to Young Living, where we enjoy healthy minds and healthy bodies. I'm now going to open it up for, I'm going to stop the recording.